Hey guys, Dr. Wong here at Next Level Physiotherapy. Today I'm going to talk about the best sleeping positions if you're suffering with back and sciatica pain so you can get the best sleep ever. This video is for those of you who find yourself tossing and turning throughout the course of a night because the pain is waking you up. One of the most common questions I get asked all the time is what is the best sleeping positions and how should I sleep? We're all shaped differently, so there's really no one-size-fits-all sleeping position. However, outside of spinal deformities, our spine has natural curves. When you look at the spine from the side, what you'll notice is the neck and low back bones rounds forward, and that's known as a lordosis. And in the mid-back area, it curves backwards, which is also known as a kyphosis. You want to find a sleeping position that keeps your spine in a neutral position. The way I like to think about the spine is like the game Jenga. In the game of Jenga, you have wooden blocks stacked on top of each other, and every time a block moves, the rest of the blocks will also shift. Your spine is no different. When one part of your spine moves, the rest of the spine will also shift. You also want to make sure that when you're sleeping, the spine is not rotated because that can add uneven pressure throughout the rest of the body. In order to stay in a neutral spine position throughout most of your sleep, you want to have adequate support. In order to stay in a neutral spine position throughout most of your sleep, you definitely need a supportive mattress and pillow. As we talked about earlier, we are all shaped differently, so why are we sleeping with the same type of pillows? We really shouldn't, especially if you have pain throughout the course of your sleep. Think about it like this: anybody can buy a suit off the rack and wear it. But if you buy a specifically custom tailored suit for you, then it's built specifically for you. At our clinic, we measure our patients' neck size and shoulder frame for a custom fit pillow. The company that creates these pillows is called Pillowise. When it comes to mattresses, the average lifespan is anywhere from 7 to 10 years. So if you had your mattress for around that time frame and you're starting to develop some aches and pains, then it's time to possibly look to get a new mattress. Another question that I get asked all the time is what type of mattresses should I get? Firm, soft, or hard? It really depends on your body type, how much you weigh, and how do you feel when you wake up in that new mattress. Now we're going to go over the do's and don'ts of sleeping positions for back and sciatica pain. One of the best positions that you can sleep in when suffering from back and sciatica pain is sleeping on your back. The way I assess sleep is from a head to toe approach. You want to make sure that the pillow under your head is not too soft, because when that happens, your head will tip backwards and cause some stress on the neck muscles. If your pillow is too high, it's going to push your head forward, and that can also cause stress on the neck muscles. You wouldn't sit or stand intentionally with your head tipped backwards or forward throughout the course of a day, right? So why would you want to put your neck in those uncomfortable positions for hours at a time every single night that you go to bed? The next thing I check for when it comes to sleeping on your back is what does a low back position look like on the bed. What I'm looking for is an excessive curve that curves towards the ceiling. If I see an excessive low back curve, or what we call a lordosis, what I know is that there's an increased pressure on those joints and muscles, and that can eventually lead to you wake up throughout the course of a night. The way you can reduce this rainbow curve of the low back when sleeping is by elevating the knees above the hips by putting some pillows underneath the legs. When you do this, the curve will decrease and the low back will be flat on the bed, decreasing pressure on the spine and the low back muscles. A second position that works really well for back and sciatica pain is side sleeping. Just like back sleeping, you want to make sure your spine is in a neutral position. Let's start with the head. If the pillow is too high, you're compressing the top part of the neck and overstretching the neck muscles on the bottom. And if you have a pillow that's way too low for you, you're completely doing the opposite, where the bottom muscles are getting compressed and you're overstretching the top muscles. Both are no good, which will increase stress on your neck while you sleep. The next area I look at is the low back area to see if it dips towards the bed like a V shape. This usually happens in softer beds where you don't have adequate support for the body. If I do see that dip, what I'll do is put a small towel or a small pillow to cover up the bottom of the waist to make sure that regardless of whatever mattress you have, that you don't sink and create that V shape around the low back area. The last part I look at is a hip, knee, and foot position when you're on your side. If the knees are stacked on top of each other, it might not be the most comfortable position, so what I recommend is putting a pillow between the knees and the ankles. What you don't want to do is cross one leg over and let it stay there for hours at a time, because then what you're going to do is create rotational stress on the low back area. If you're used to crossing the top leg over, what I would recommend is stack some pillows so the top leg is resting on a pillow, so at least the length of your leg is parallel to the bed. The worst sleeping position that you can do for back pain and sciatica is sleeping on your stomach. So just don't do it. So let's do the head to toe test. When you're on the stomach, you have to rotate your head to one side of your body. This can cause increased pressure in the neck, which is very bad for muscle tension. On top of this, if you have a pillow that pushes your neck up towards the ceiling, this causes even more pressure. Now let's move to the low back area. When you're in the stomach, sometimes the low back will dip into the bed, kind of like a U shape. And when that happens, the low back muscles will tense up and create more tension, which can increase back pain and sciatica. Another reason why I'm not a big fan of stomach sleeping, because you're compressing your vital organs like your heart and your lungs. So when you do breathe, your lungs have a hard time expanding. Now that you know the best and worst sleeping positions for back pain and sciatica, comment below and let me know which of these positions work for you. Also, if you found these videos helpful, please consider subscribing so you don't miss out on our weekly videos. As always, move better, age stronger, and I'll see you next time.